Australia required bike helmets to cut head injuries, then watched cycling drop sharply and the broader safety math shift. This is Unintended Consequences, Episode 83. In July 1990, Victorian roads that had carried thousands of daily cyclists suddenly looked emptier after the state made helmets compulsory for every rider. Helmet use rose quickly, yet total bicycle trips fell by roughly one-third in the first 2 years, according to transport counts and hospital data. The policy had been written to protect heads in crashes. Instead, it removed riders from the network that had kept collision rates low in the first place. Public health doctors and road safety researchers in Australia had watched rising head injury admissions among cyclists through the 1970s and 1980s. They knew from crash studies that a hard shell helmet could absorb impact energy and reduce skull fractures. Medical associations therefore pressed state governments to treat helmets the same way seatbelt laws had been treated a decade earlier. At the time, cycling was still viewed mainly as recreation or children's transport rather than daily mobility. The dominant metric was injury per trip, not injuries per capita or overall population health. Legislators saw a low-cost rule that aligned with existing road safety bureaucracies and with parents' understandable fears after publicized child cyclist deaths. The arithmetic they worked with compared observed head injury cases directly against the protection a helmet shell could provide in a laboratory drop test. It did not yet subtract the health losses that would appear if the same riders stopped pedaling altogether. Victoria led with the first statewide adult and child mandate on July 1, 1990. New South Wales, South Australia, and the other states followed within 3 years. Police issued warnings, then fines, and helmet sales spiked. Early evaluations reported large increases in observed helmet wearing and modest drops in head injury presentations at hospitals. Proponents cited the injury reductions as proof of concept. Transport departments began planning similar rules for the remaining jurisdictions. A few cycling advocates warned that compulsory equipment might deter occasional riders. Those concerns received little weight against the visible injury statistics. The rollout therefore treated helmet wearing as an isolated variable whose only measurable effect would be on the skull of the person who crashed. Within 2 years, bicycle counts on key Melbourne and Sydney screen lines fell between 20 and 40%, with the steepest losses among teenagers and short-trip commuters. Because helmets added cost, inconvenience, and a sense of risk to an activity many viewed as casual, marginal riders simply stopped. The remaining cyclists were fewer, yet each still faced the same traffic environment. The safety in numbers effect documented in later international studies meant that lower volumes produced higher per-cyclist collision risk. When the number of cyclists on a given street drops by one-third, drivers encounter them less often, adjust their scanning habits less automatically, and therefore allocate less attention to the space where a bicycle might appear. That shift in driver behavior raises the probability that any single remaining cyclist will be struck. At the population level, the lost physical activity benefit of everyday cycling exceeded the measured reduction in head injuries, according to health impact models that compared disability-adjusted life years from crashes against those from inactivity-related disease. A person who stops cycling for 30 minutes a day loses cardiovascular protection, whose cumulative effect on mortality risk is larger in most epidemiological models than the protection a helmet offers against the relatively rare event of a head strike. Countries that later kept cycling rates high, such as the Netherlands and Denmark, achieved their low injury rates through separated infrastructure and traffic calming measures, not helmet rules. Helmet wearing there stayed below 10% for decades. The Australian data therefore revealed a classic substitution. An individually rational precaution altered the collective exposure pattern in ways the original injury-focused models had not captured. One objection sometimes raised is that the participation drop might have been caused by other factors such as fuel prices or weather. Yet the timing aligned with the mandate dates across multiple states, and the decline was sharpest among discretionary short trips rather than among committed commuters who already owned helmets. No Australian state repealed its helmet law. Instead, debate shifted to enforcement levels and to whether infrastructure spending could restore participation without removing the mandate. Some cities began building protected lanes in the 2010s, and limited observational studies showed modest rebounds in ridership where those lanes appeared. New Zealand, which passed a similar law in 1994, recorded comparable participation drops and has kept the rule in place while quietly funding more separated paths. Today, the policy remains settled in statute even as transport agencies in the same jurisdictions now promote active travel targets that implicitly conflict with the earlier deterrence effect. The tension persists because the original legislation succeeded on its own narrow terms. Helmeted heads in crashes were fewer, while the broader ledger of population activity and network-level risk stayed outside the accounting that justified the rule. When a rule changes the number of people who choose an activity, the safety calculation must track both the protection per participant and the change in total participants. Infrastructure that lowers risk for everyone scales differently from equipment that only some will adopt. The helmet case shows how an intervention aimed at one measurable harm can shift the larger system in the opposite direction once behavior is included. What current safety proposals, whether for micromobility, vaccines, or environmental rules, would look different if participation effects were modeled before the mandate rather than discovered afterward? And that's where today's story leaves us. If it changed how you see one everyday decision, that's the whole point. Pass it along to someone who'd appreciate it, and we'll be back tomorrow with another case. And if you'd rather watch than listen, find us on YouTube at NARA Network, links in the show notes. And before you go, this show is part of the NARA Network, a family of daily podcasts on tech, science, and markets, each one a short, sharp briefing you can finish on the commute. If today earned its place in your feed, here's your next listen. SpaceX Daily, the daily companion for following SpaceX as a public company, from Starship to the stock ticker. Find every show free at naranetwork.com. And on the website, every episode's visuals live in our free image gallery at naranetwork.com/gallery. Royalty free under Creative Commons, download with attribution. This episode used AI voice synthesis of my voice. Editorial selection and analysis are my own.